You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people that have periodontal disease. With us we have Dr. Gordon Wilson. Dr. Wilson, welcome to the program.
Oh, thank you, Randy. Thanks for having me.
Now, before we get into today's topic, and we've had you on the program before.
Correct.
A lot has changed, by the way. I guess you've treated hundreds of people,
Probably thousands of people by then.
With periodontal disease. Is this your focus? I mean, is this what you like to do?
This is definitely the majority of my practice. I would say I probably do about 60% treatment of gum disease. The other 40% is doing cosmetic dentistry.
So who is your typical patient that you see?
A typical patient for me might be somebody age 30 on up who has red, swollen gums. Maybe they're...
I mean, that's a big sign right there.
It's the biggest sign, yeah. Bleeding is the biggest sign. You know, maybe they have bad breath. Maybe they haven't been to the dentist in a while because they've been told they have gum disease and they just don't know how.
You say there's a lot of people that have been diagnosed with gum disease or periodontal disease and then they do nothing about it. Mm-hmm. You know, they don't go to a dentist to have treatment. Well, what's the fear? What's the problem?
Yeah, I think the three main reasons that we typically hear in our office is that maybe they didn't know that they had gum disease. Or when they found out that they had gum disease, they were afraid to do anything about it, or they just didn't know what to do about it.
Now, has a lot changed over the years, in the last 20 years in treating gum disease?
Over the last 10 years now, I've been using a procedure known as LANAP that uses a laser to treat moderate and severe periodontitis in lieu of using a scalpel and stitches.
Okay, now, you want to make it clear to me, you say that you're not a periodontist, but you've been doing this for how long now?
Over a decade now.
Okay, let's start with what is periodontal disease or gum disease. What is it?
Well, periodontal disease is an infection of the teeth, the gums, the bone that hold the teeth into place.
How do you know if you have it, by the way? Well, I mean, what are the symptoms?
Some of the symptoms are, of course, bleeding gums.
But doesn't everybody have a little bit of bleeding gums, though? I mean, when you floss, they're going to bleed a little bit?
They do, but that's not normal.
Okay.
Like we mentioned before, I mean, if you were to wash your hands and they were to bleed, you wouldn't think that that's normal.
Right, right.
Same way if you came out of the shower and your whole body was bleeding because you just washed yourself, I mean, it's not normal.
But is that an overstatement? I mean, so your gums really, when you floss, should not bleed?
They should not.
Oh,
healthy gums, healthy gums are pink, they're firm, they're stippled like the skin of an orange, and they don't bleed.
Okay, so bleeding, number one sign, what else?
Bad breath, puffy gums, redness.
So we mentioned bad breath.
That's right.
Red gums, what else?
Red, puffy, swollen gums. Usually there's no pain. Unless it gets advanced into the advanced stages of moderate and severe periodontitis. Sometimes there are changes in the spaces between your teeth, which indicate changes in the underlying bone. In fact,
so the teeth start to move?
Correct. Just last week we had a patient in our office, and she'd come in, and when I sat down to do the exam, she told me just how thrilled she was that she came to see me about a year ago. And we did the laser procedure on her. And she said that her gums had filled in. Now, I questioned it because I didn't remember what her teeth looked like before, but we'd actually taken a photo. When I looked at the photo, she was right. She had spaces between her front 4 teeth. And she was told that she was going to lose all 4 of those teeth. She came to me, we did the laser, and just last week her teeth had actually shifted back together. It almost looked like we'd done orthodontics on her.
All right.
Her smile had improved, and I wouldn't have believed it if I hadn't seen the picture myself.
What happens, and let's talk about treatment options. There's traditional treatment options, which is what? Surgery.
In the early stages, in the gingivitis, which is the first stage, it's the only stage that's reversible. And then in the early periodontitis, those are treated with a procedure known as root planing. That's
root planing.
Root planing. Okay. Scaling and root planing.
Describe that.
Let's say that a routine cleaning is where we go in and we clean the teeth above the gum line.
Okay.
Okay. Root planing is where we anesthetize the patient.
All right. We
go down below the gum surface and we remove the calculus from the root of the tooth. And that's very effective for 4, 5 millimeter pockets, sometimes 6 millimeter pockets as well.
Now, what about more severe cases? And what defines a more severe case?
The periodontist will do a procedure known as flap surgery. Where,
describe that.
Okay, basically what flap surgery is the periodontist is going to make an incision along the gum line, okay? And then what they're going to do is they're going to separate the gums from the tooth and the bone to create what's known as a flap. And what this does is it gives the periodontist direct vision so that they can see, they get better access
to the infection.
So is it bacteria?
Is it plaque? What is it?
What's that?
The infection. I mean, what is it?
Well, the infection starts off as plaque.
Plaque.
Okay, and then your saliva.
Is tartar and plaque the same thing, by the way?
No, plaque is the thin, sticky film of food and bacteria that form on your teeth constantly.
Okay.
Okay. Now you've got saliva in your mouth constantly, and there's calcium in your saliva. This calcium in your saliva hardens the plaque and turns it into what we call calculus, but it's also known as tartar. So tartar is basically hardened bacteria.
Okay, so when it goes under the gum line, that's when you're in trouble.
Right, because it progresses. What it does, it kind of snowballs. It kind of progresses right down the root and just.
So the surgery, and it's called root planing.
No.
No.
The non-surgical pocket reduction is called root planing. The surgery, you know, it can be called flap surgery. It's also known as osseous surgery.
So for people with advanced periodontal disease, the standard procedure is surgery.
Correct.
So they cut away the gums, and they
will
scrape.
Correct. They'll make an incision.
All right.
They'll separate the gums from the bone in the tooth so that they can get direct access to the tartar.
Okay.
To remove the tartar, okay, which again is the source of the infection. So they want to get that tartar off of there, and then they'll stitch it back together and probably put a periodontal dressing on it or something like that.
Okay, the other option, that's one, is surgery. What's the other option?
There are several other options. The primary one in my office is a patented procedure known as LANAP. And what we do with LANAP
That's a laser?
That's using a laser to go in and selectively remove the diseased gum tissue and kill the bacteria that are causing the infection.
Is this virtually a bloodless surgery then?
No.
Is it even called a surgery?
Yes, it's a surgery. But it really doesn't seem like a surgery because it's so minimally invasive. And so I've got thousands of patients who are coming in to see me to have their gums treated, and they're coming back after we've treated them to do our periodontal maintenance appointments, and the bleeding is gone, the swelling is gone, the bad breath is gone, you know, and the gums are healthier and the patients are happier.
So you have patients that dealt with bad breath for 10 years plus, bleeding gums for many years.
I've got people who come in all the time, and so often they'll come in and they'll say they haven't been to see a dentist in probably 5 to 10 years, and so you know there are a lot of different issues going on in their mouth besides just the gums. But of course we're going to focus first on the gums, get the gums healthy because we want to get a good foundation. Once we've got a great foundation, a nice healthy bone, nice healthy gums, and the teeth are now solid instead of loose, now we can build on that.
So loose teeth become a little stronger?
Loose teeth, yeah. They
after
become
periodontal treatment?
After my LANAP procedure. What happens is somebody will come in, and I cannot tell you the number of people who have come in and said, you know, the dentists want to take out 6 teeth or 8 teeth or whatever. And we'll go in and we'll treat them, and they keep all their teeth.